All right, good afternoon, ladies and gentlemen. Unfortunately, if you were here for the previous session, you're stuck with me again. I apologize for that. We'll try to keep it entertaining and lively. Welcome to our County Veteran Services panel. Today we have some wonderful guests that are going to talk about what they're doing in their different counties and hope drive some conversation in regards to some best practices as well as what works well for them, what they've learned in the past. And, hopefully they give me a good service officer or 3 here in the near future. We'll see. So just a little bit about myself. For those of you who were not here the last panel, my name is Cruz. I'm one of the program managers with your Washington State Department of Veterans Affairs. I oversee 8 different programs directly related to veteran services throughout the state. Currently located at our Olympia office in downtown Olympia. If anybody would like my contact information, I'll be more than happy to share it with you. A lot of the slide presentations and information you're receiving today will be emailed to you at the end of the conference. So you'll have access to all the slide presentations as well as the video recordings that we're doing. So if there's something that you may have missed, you'll be happy to go through it and see if you could rewatch it and maybe catch that nugget that you were looking for. But other than that, what we'll do is I think Steve has a couple of things to say, and then we'll introduce our panel. We'll have them go through a quick introduction quickly, and we'll just get started.
Good afternoon, everyone. My name is Gill. I'm the Veteran Services Administrator and Tribal Liaison with your Washington Department of Veterans Affairs. I know that many of y'all were in the previous session, or you probably know me from elsewhere, but I just wanted to introduce myself real quick. This is an important topic. This is a huge topic, talking about veteran service officers and our county veteran service officer partners. I also wanted to mention we have tribal veteran service officer partners, and we have nonprofit veteran service organizations. Many of you are familiar with groups like the American Legion, the Veterans of Foreign Wars, the Disabled American Veterans, and there are also state veteran service officers out there. So there's no one right way to deliver veteran service officer services. There's like 4 awesome ways to do it. But one of the things that we wanted to highlight was our county veteran service officer partners. And we have a panel discussion here with different county veteran programs, because the counties, there's no mandate for counties to provide VSO services. Many of them do. 23 out of our 39 counties currently provide VSO services. But counties do a lot of other work too with their County Veterans Assistance Fund and the resources they have at the local level. So this is kind of a best practices panel for our counties to learn a little bit from each other, to talk amongst themselves. There are 4 counties up here. There are a lot more in the room. So, there will be discussion and the opportunity for questions. And there's certainly an overlap between the work that veteran service officers do and what our county veterans programs do. But that overlap's important. But again, counties do other types of services that will be talked about today as well. One of my roles at WDVA is as the agency's tribal liaison. Indian tribes are also doing this type of work, and they have tribal veterans programs. Many of them have accredited tribal veteran service officers too. It's important to acknowledge and recognize that. We have 29 federally recognized Indian tribes in Washington State, and we're trying to get out there to have as many veteran service officer partners as possible. Counties, Indian tribes, the nonprofits, all of the above. There are also some tribal partners here in the room today as well. So we want the discussion to be inclusive, understanding that there are certainly differences between the way that counties work and Indian tribes work. We recognize and respect that sovereignty, but tribes are also a partner in this work, and we want to be working together. Big tent concept here, and we're all on the same, we're allies in doing this work. One of the other things I do is our county and our county and our nonprofit veteran service contracts. So Washington Department of Veterans Affairs, we do have some state dollars that we provide to nonprofit veteran service organizations and a limited number of counties through a county veteran service officer pilot. So we do have some client service contracts with 5 nonprofits and 6 counties. I recently, Mary Ellen Hill, I'm going to introduce here. Mary Ellen will just raise her hand, is another one of our program managers. And Mary Ellen is taking over the contract management portion of our county and nonprofit veteran service officer contracts. I've been doing that work for a long time. I'm not going anywhere. I'm still on the same team with Mary Ellen and Paul. And but as our VSO network grows, we realize that we need to position some resources to support that in terms of training and accreditation and systems access, but also the funding that's out there. The funding we do have is great. There is a real potential for that funding to expand in the future as new legislation is introduced, as the state legislator increases dollars that are available. There's also on the horizon, there has been some federal legislation introduced to create a grant program for rural counties where state veterans agencies like the Washington Department of Veterans Affairs would be a pass-through entity to provide grants to smaller rural counties that might not be able to afford a county veteran service officer. Legislation hasn't passed yet. It's been introduced in the House a few times, but we're watching that as well. Because if that legislation happens, WDVA, we're going to position ourselves front and center there and try to bring down some of those federal dollars to support our county partners as well. Okay, that's a lot of stuff. You guys didn't come to hear me. You want to hear from our county partners. Geez, I'm breaking things. So what I'm going to do is I'm just going to stay kind of in the background, and Paul will facilitate the panel discussion. If any questions come up related to our state funding, our policy, those types of topics, I'll be happy to field those questions. I'm also happy to hang back after the session and talk about this stuff all day long. So thank you guys very much.
Awesome. So what we'll do first is we'll just start with our lovely presenters today. If you could just take 1 minute, do a quick introduction, and then we'll get Robert prepared 387 slides for you to hear today. You can see who's going to get a brunt of this today. Yeah, so if you want to start off, Chris, just a quick introduction, sir.
All right. I'm looking around here. There's like 6,000 years of VSO smartness in here. I could tell. It's the last 3 years I've been at this conference. My name's Chris Diaz. I'm Skagit County Veteran Service Officer. We have some other Skagit County friends here as well, in Island County and Snohomish. But anyways, I've been doing a little over 2 years. I was a certifying official for college before that. But I can tell you that I'm passionate about this and passionate about growing this program in our county to get as many veterans and their family members taken care of for today to the future. So nice to meet you.
Well, so Paul told me I couldn't do 388 slides, so unfortunately I had to shorten it. My name is Robert Sheetz. I'm the Veterans Program Manager at Pierce County. Background in basically everything veterans programs I started in Wyoming with Wyoming at Work doing that kind of stuff. Worked through education system, became a veteran service officer, and now I manage programs at Pierce County. So you'll hear more from me in a little bit.
All right, so Chris Dorcheus. I'm a Air Force retired first sergeant. After I retired, I joined the county as the manager for Spokane County Regional Veteran Service Center, where we had 5 accredited VSOs, 2 fully time front staff to help with the intakes, and just looking forward to any questions that you may have for me.
Tom Hicks, Air Force veteran as well, soon to be retired. So go me. From Stevens County, but work in Stevens, Lincoln, Ponderay, and Ferry County. And yep, we got 2 VSOs. Liz is in the back there. She's awesome. My coworker as well. And yeah, same thing. Just looking forward to the questions and seeing how we all can get better at what we do.
All right, that sounds great. So Robert, if you'd like to start us off, sir, he'll give a few minutes overview of what he does in his county, and we'll continue the same for the other 3 gentlemen. And then from there, we will open it up for discussion, and you will be free to bombard them with all the questions you have.
All right, I'm going to try to go through this quick because I'm the only one that's got a PowerPoint. So let's play through this one as quick as I can. So here in Pierce County, through the RCW 7308, which I'm sure many of you in this room are familiar, I'm not going to quote everything from it, the county does provide food, rental, utility, medical assistance, and per law burial assistance for indigent veterans. So, in our office, we do it depending on income for individuals. For rent and utility, it's once per year. For food vouchers, it can be up to 3 times a year, depending on the income of the individual. With that said, a couple of years ago, the county recognized that we were struggling when it came to providing services to veterans. Pierce County is quite a large county. We have about just under 90,000 veterans in Pierce County, and so we established the Veterans Resource Center. We partnered with your WDVA, as well as the VA, Supported Services for Veteran Families, and a couple of nonprofits, invited them to work directly out of our office and provide services to veterans throughout the county. That included us bringing on board 2 WDVA veteran service officers. So we were one of those counties that had nothing. And for a large county, that's a bad idea. So what we ended up doing is we created a program, post-COVID, rehabilitated, what we call Veterans Housing Options Group. It's one of our biggest shining stars. VHOG is how we connect to the homeless veterans or the potentially unhoused individuals that are in Pierce County. Year to date, we've worked with about 450 individuals, worked on getting them connected to housing services, social services, and other programs. We invite all of those nonprofits in every Wednesday, so unfortunately I wasn't there today. We work directly with those veterans. It's a service where you can partner with all of your nonprofits, your state, federal, local agencies, get them together and provide services directly to those individuals. Now, David Puente earlier today talked about Orting and the transitional housing project out there. Through us and our county funding, we also provide a transportation system for the veterans that are out there in Orting. If you haven't been to Pierce County, it's 19 miles from Orting to Tacoma. So veterans out there, to put it nicely, they were struggling because they were far away. So the county provided the transportation system to get those individuals back into our larger transportation system because there isn't an established one out in Orting. So we use county dollars to be able to provide that. And last but not least, just my contact info, which I can certainly give out cards and stuff if anybody needs. But that's a little bit basic idea of what we do in Pierce County. And I will pass the floor off to my colleagues over here.
I don't have a slide. I actually do. I turned one in, but
Oh, very good. Apologize for that.
no, that's okay.
We'll issue again.
So, that's fine. So I'm brand new to being a VSO. I'd say still. I got like I said, a little over 2.5 years under my belt. I think I'm up to almost 600 accounts on the TVB. Tyler system?
Yeah.
There we go. I think as last December, Tucker sent me numbers and it was like $1.3 million in lump sum payments. Took about a year and a half to get there. I guess that's good. That's what they said. So, in Skagit County, we have Skagit Vets Connect. It's located in Burlington, Washington. We have seen an increase of veterans coming into our office since I've been able to hand out probably 6,000 of these cards that the county pays for to hand out with flyers. They're starting to come in for more housing now. They're starting to come in for more benefit questions, want to know how to prepare end of life kind of stuff, advanced directives, STWS billing issues. Let me see. It's not just claims that my particular office is doing. It's just me now, but I'm actually doing it all and booked out about 3 months, almost into November, literally, on top of doing county stuff. But I think we've put in about 30 veterans into housing in our little rural county in the last year and a half. That's because I'm passionately dangerous, as my community action colleagues call me. I think that was more of an insult. I took it as a compliment. So, pushing people to do their job and put people in housing through SSVF and VASH can take a long time if you don't have the right people in positions. And sometimes if they get burnt out, you got to push them a little bit. But just since we're doing outcomes, a little bragging here, our coordinated entry Volunteers of America manager said that our numbers of veterans have decreased in the coordinated entry system, which means they're getting housed, they're getting the benefits they need, and all the extra resources. We spend a lot of time. I travel all over Skagit County. I have offices in Anacortes. Soon to have something in Samish. I got one in Mount Vernon, which is the public health department, Burlington, recovery centers, all kinds of stuff, East County resource centers. So I go where the vets and their families are. because it makes it a lot easier. Transportation's a little weird in rural counties, right? So it's not free for us in Skagit County like it is in Island or other counties, but we're working towards that. Recently, we got a donated van. I was able to get Skagit Transit to donate a van. We're getting it wrapped. You guys are gonna be seeing it on the freeway going up and down 5 and 20. It's gonna look like a race car with 7 passengers in it. Not even kidding. Not even kidding. And that's gonna make claims a little bit quicker for us, because we're gonna be able to, those veterans are gonna be able to take those medical appointments, the ones that they're offered right off the bat, and not have to worry about time of day, traffic, what's on their schedule. They could just schedule it just like that based on where the routes are, and it's all free for them. It's going to come through taxpayer money from the county. So, and then they're also going to donate a paratransit van, because I told the county commissioners we got to get ready for our Vietnam veterans. They're going to require more transportation assistance versus driving themselves down there. I don't know about you guys, but I do not want 90-year-olds, no offense, driving all the way to Seattle or Olympia for a 10-minute appointment from Skagit County, if that makes sense. So with that said, there's a lot more stuff going on in Skagit County that hasn't been going on for a long time. We got 2 veteran stand-downs a year now, which last stand-down came with about 363 people signed in over 2 days. Did you guys like it?
It's good.
Yeah. So it's gonna be 4 buildings this time instead of 3. So getting those resources out to people in one-stop shop kind of deal. That's what we're trying to do, and that helps with our claims. Zach, where are you at in here? Yeah, is Tyler coming? Are you coming?
I'll be there.
Yeah, you guys are all going to be there.
Yep.
Tyler will be there. We have Snohomish County or Whatcom County coming down, Snohomish County coming up, Island County coming over. So that way, because there's a lot of bleed over for service officers into my county and their counties, so that way we can give them warm handoffs. That's all I got.
All right, well, I guess.
The other quiz.
So for me, I'll start out with a little bit of a history lesson for Spokane County Regional Veteran Service Center. Back in 2019, there was a partnership with the Washington State Department of Veteran Affairs and our county to combine efforts and create this county and state co-located facility. So the director at the time was Kat Nichols, and she was a WDVA employee coming in as the director for Spokane County. What that did, though, that allowed, what they were originally doing was just facilitating the Veteran Relief Fund. But that idea created, hey, a one-stop shop of all state and county services that could be available to veterans and their families. And it also created our VSO positions that we have. Like I mentioned before, we currently have 5 veteran service officers. We do everything ranging from education, claims assistance, burial assistance, facilitate the Veteran Relief Fund. So it is trying to create that true one-stop shop of wraparound services for the veterans and their families. So that was just a history lesson. I will say with our numbers this year, I am proud of my team, who majority are in this room today. We've completed over 8,000 planned services for our veterans. So that's essentially serving over 8,000 veterans in our Eastern Washington area for that. We've completed over, Julio, correct me if I'm wrong, 747 claims thus far this year. And in Q1, Q2 numbers of $5.3 million back in the hands of the veterans and their families. So a really robust team that we have here. We do not have a backlog. We have a totally unique process for intake for veterans and their families, depending upon the need of the veteran and or family members. So recommend, if you're in our county, have any questions, please come out and see us. We're located at 1117 North Evergreen Road, and that's out in Spokane Valley. Or you can always call us, 509-477, Jeannie's looking at me like, don't say it, 3690. So that's our central number.
Cool.
Yeah, see, we call
Gotta follow that. So I work with Liz. There's just 2 of us, but our biggest challenge is getting out to the vast area that we cover, because we work in the 4 counties, and we have a couple of our commutes are almost 2 hours, to get out to the people we go to. We are basically building from ground zero like everyone else. I think we're on the earlier stages of that as well, but we've taken a lot of example from the individuals that have been doing it before us, and we're just literally smack dab in the middle of rebuilding the program from basically nothing to begin with. And so we're really eager. Our big thing is building the partnerships, learning from each other, sharing the load. One thing that we kind of noticed, at least in our tiny corner of the world, people were very protective over who helps who and why they do that, and it just kind of, as being someone who came into this fresh, didn't know anything, it kind of blew my mind, because I was just like, why are we fighting over who's helping who, and I'm better at helping, you know, it was so weird to me. So we're doing our best to really bridge those connections to repair that and say like, hey, we're all a team up here, and if it ain't me, it'll be him or her or them. Like, we'll get you what you need to get, you know. And that's what I found is to be pretty rare, actually, for, again, our little corner of the world. We probably all will sing the same songs of struggles that we've dealt with, but it's just one of those things that this is a never-ending process, and you really have to bring that into your mindset when you do this. And, you know, just hearing 5 VSOs is like, oh my God, what could we do with 5 VSOs? You know what I mean? I'm sure you're sitting where you're at being like, 5, man, I wish I had 8. You know, it just never, you know, the more that we can band together and really bridge the connections to every part of our community, you know, because veterans are everything. They're, you know, and we have travel problems, we have housing problems, we have all these problems. None of us can be the expert on all of those things, you know. And if you are thinking you're that person, you're probably dropping the ball somewhere and you just don't know it, you know. So yeah, I'm excited to be here. I'm excited to answer questions, and let's do it.
All right, now that we've got a good overview and understanding of our 4 presenters here and what their county brings, does anybody have any questions thus far? All right, we got, thank goodness, because I was going to start making some good questions.
I was really hoping it would just be like calm for a minute.
Hey, Mark, keep it PG.
So this question is for Chris Diaz. One of the things that we've sort of talked about also is the van, the bus, that type of thing. Who drives? And what are your requirements for drivers?
Yeah, so we used to have DAV in Skagit County. Nowadays, the qualifications, eligibility to be a DAV driver, you can't have anxiety, you can't have PTSD, and I'd say 99.9% of our vets that come out of the military have ran into some kind of issue that has caused something. So what I've done is said, hey, let's get a van, Skagit Transit. I know you have a surplus coming up. A new executive director came in. It was a good opportunity to build, you know, ask that question, say, hey, since you're new, why don't you put a big stamp in Skagit County for us? So what's happening is we did the van with a $10,000 agreement to Helping Hands, who's going to manage this, and then we're also doing a separate agreement for around $140,000-$150,000 to hire somebody, train them. They're going to be managed by Helping Hands with the requirement of they're going to be raising money. They're a great nonprofit that raises tons of money, especially with Robert Gates and Becky Gates, because they live in our county, right? It's very helpful to have SecDef and live in your county. But that's what's going to happen, and then the paratransit van will go over there as well. But I just made Daughters of American Revolution. You guys heard of them? They donated $6,000 to help wrap the van up. They did this on purpose because they knew that. They asked me, hey Chris, what do we need in this county? I said, we need transportation, and it's got to be free because we have our Vietnam vets that are coming up with our Gulf War right behind them. We have around, I'd say we have over 10,000 that have actually said yes on the census, or not haven't said yes on the census, but the census says around 9,000 something. But we need to start providing that transportation to, because all of our appointments are all over the place. I don't know if last time you guys have put a claim in for somebody or done a claim yourself. I got guys calling me, hey, they're gonna send me to Olympia, right, for a mental health because I can't figure out how to use, my online computer, right? And I'm going, call them back and tell them you need to reschedule because we don't want you driving down there at 87, 90 years old, or you already have PTSD, and you know what I mean? It's just a gauntlet of problems heading down there. Bellevue, all these different places in our west side, it's just horrible down there with traffic and all that stuff. And I'm trying to help them avoid those things. But yeah, so transportation, I would start, all three of our commissioners, I've had many conversations with them about this stuff, and they are 100% on board on supporting. They gave me a clean slate, like basically, Chris, you just do it. And then we're just gonna say, yeah, right, Chuck, you better get on board, right? and it's been working out, and the outcomes, like everybody was talking about, right? A lot more money's coming back into the county from the feds. People are having better appointment times. The processing times are taking less because we're finding all these different ways to save money and also get people moving. Did anybody know? Do you guys know that like LSGS and these other companies will offer you a ride? Won't offer you a ride. You have to ask for it. Did you guys know that? I didn't know that until recently. I don't know. Did you guys know that? You have to ask for a ride for them to help you do that. So tell your vets that. Anyways, that's like. Did that answer your question?
My question is for Mr. Sheetz. I'm his next door neighbor in Kitsap County at the Veterans Transitional Housing. Can you clarify for us? I get guys that come to us from Pierce County and they want to use your Veterans Assistance Fund.
This is where it gets interesting for counties, because we love to pretend the invisible borders between counties matter so much when sometimes they don't. But in regards to services for folks, like if we had a Pierce County resident that was residing in transitional housing outside of the county, it kind of becomes a case-by-case basis in regards to what types of services we would provide. In a situation like that, the challenge really is transportation. Like in your case, I'm assuming you're talking about being up in Port Orchard.
Right.
Port Orchard to Tacoma is not exactly right next to each other. And the challenge being is how does the individual get from point A to point B? WDVA not always wanting to help drive a person from point A to point B, or other organizations like DAV or whatever. But I think with a lot of counties in the state, if you reached out and said, this is the situation we're dealing with, they'd probably find a way to work with you. One of the interesting things about veteran services here in the state of Washington, as somebody who came from another state and saw how services were done there, every county does things a little bit differently, but the goal at the end of the day is to serve the veteran. So I think if we had an individual that was residing up in Port Orchard that wanted to move back to Pierce County, we'd certainly find a way to work with them.
Thank you.
Hi. Are all of your veterans assistance funds only staffed by VSOs?
No.
In other words, are all of the people who service your clients of veteran assistance funds, are they all accredited VSOs?
So again, I think it goes back to what Robert was saying. Each county does the Veteran Relief Fund differently, right? So for Spokane County, yes, that is entirely true. It's our office that facilitates that program. We have our own policy in regards to the eligibility, guided by RCW, of course. But how we facilitate that, for us, it's a one-time financial assistance trying to seek a positive outcome, right? So it entails a little bit more with our Veteran Relief Fund than other counties. But I don't know if Tom.
So for ours, we actually ran into, I hate these things, can you hear me? Everyone can hear me, right? We ran into a very interesting thing is we have a definition problem, right? VSO, right? Veteran Service Organization versus officer, right? In our county. And so where we ran into a little bit of resistance at first is we were not being recognized as VSOs, accredited VSOs, as being able to process that because it was a conflict. She gave me two.
I gave you two.
So it was like
Double up.
yeah. You want me to hold that one too? But so we had to go through the process to say like, no, we actually are, you know, an organization. We are recognized. We should be kind of, you know, in the mix here. Got that cleared up. But then what we realized is in our area, it's very remote. And then on top of that, these veteran service organizations, such as the Legion or VFW, they're kind of dying out a little bit. There's just not the participation, right? And then there's also resistance to participating. So we identified rapidly that there are people who need this assistance but are reluctant to engage in the process because you're going to have to go through an organization. So once we identified that and we articulated it to our commissioners and stuff like that, said, hey, we need to shake this up a little bit. Not to mention, I don't know how it is in everybody else's county, but our guys meet once a month, and other than that, good luck finding one. Oh, and by the way, our process had to have 2 signatures. So now you got to find 2 of them. Even from the same post is like, yeah, we'll call Greg and he'll be here in an hour. Like it wasn't as clean as it could be. So we were finally able to transition it to say like, hey, we still want those organizations to have that power because we want them to exist, and it does kind of give a hook for veterans in need to have community, you know. But also we have an office that's staffed 5 days a week that if you're an emergency, you can come in there and we can start that paperwork to get it processed. And in some days, we can get it processed that day. So it was a real big shift to get that change, but it was definitely beneficial, which is kind of the opposite of what it sounded like, you know, these guys do. And we modeled a lot of the stuff that we did or are trying to do off of Spokane, but quickly also realized that a lot of core things for the way they process it just wouldn't float in our county. So it is very unique to each county and the challenges that are being faced.
I ask because I'm from Clark County, the Veterans Assistance Center, and we do things completely different than almost all of you. So I just wondered if that was the way it was. We have VSOs, but they're separate from our CSOs. So.
And that would be the same way it is in Pierce. You know, we were having a discussion earlier about like the changes and differences between all the counties. I sent an email to every single county in the state of Washington at one point and asked them how they do all of their services, pulled all their policies and procedures and evaluated ours in Pierce County versus how other counties do it. And I can tell you there's a lot of difference across the board. We were joking earlier with House Bill 2014. There's a section in there for other than honorable discharges that if you're a 0% veteran, I reached out to 16 different counties last week and currently have 7 different answers to how they interpret the language in that legislation. So it's really unique how different counties do the exact same thing here in Washington.
Which I think is good personally. What works for us is not going to work for them, and we stay focused on the veteran needs relief. How can we do that?
In Skagit County, we had, before I got there as a service officer, they already had a contract with Community Action, and which created Skagit Robert and Gates Vets Connect, and they do direct services there, which are the vouchers from the Veterans Assistance Fund. We do meet monthly, every month. We kind of help oversee, manage that, make sure the vets are showing up for the meeting. But we've just overhauled our policies and procedures as well. I said we need to come up with a plan to, if somebody doesn't fit what's required, we need to have some kind of exception, rule in place, because we have an excess amount of money because of COVID right now. So we can spend that money on other things. So if you're 100% veteran and you're not meeting that 50%, right, you're too high, and you need a water heater, but you're only making $3,700 a month and your rent's $2,200, you know, and your water heater goes out, we want to make sure yeah, you won't qualify under the RCW, but then you could qualify under the excessive amount of money to help pay for these other things like housing, car repairs, other things like that. So, but we leave that up to, so it's a Veterans Advisory Board to the commissioners. So sometimes our veterans, our executive board are great people. Sometimes we feel like they get it wrong and we're gonna go ahead and pay for it anyways if they said no. Or if they say, yes, let's pay somebody $10,000, and we're like, ooh, pump the brakes here, hold on, right? So, but we make sure that it's a really good, we sit down and talk about it, you know, the director, my boss, the commissioners, whatever, whoever we need to talk to about it. If we need to give somebody 15 grand to help fix their roof, we might say, hey, go back and get us 3 more quotes that are not 15 grand. So, you know what I mean? So things like that. So, yeah, we try to figure it out.
I got a couple more questions here. Sean.
Thank you for standing up, Paul. I appreciate it.
Still standing.
Love that guy. Actually, this question goes out to all of you. So I know, based on the RCW and county practices for each one of your counties, that you see certain red tape with your daily doings, right? I guess out of pure curiosity, knowing the barriers and blockades that you all face, I'm gonna challenge you with this. What's one thing you would like to see change based on the veterans and the population, the restrictions that you face as the organizational leads for your veteran service programs? Really, I wanted to screw with you, Chris, but this just benefits everybody.
No, I've already asked the commissioners, the director, I said, just give me all the power. And because I want to give, I'm a giver. I want to give people what they need, reasonable requests or whatever. But that's, I mean, I think that's what it is. I'm blessed in the county that I'm at because the 3 commissioners are very open to veterans and the things that are coming our way in our Skagit County. And our new director from Island County, we stole him, apparently. And then, you know, my chain of command basically are like, yeah, they say yes almost 99% of the time. So if I could change something for the better, I would say bump the tax up a little bit, and then let's just build right now. That's what I want.
Yeah, I was gonna say the same thing, because a lot of counties out there, the levy, they keep it as low as they possibly can. You know, reality is for some counties, it's difficult to increase the levy lid when it comes to being able to provide the services. You know, realistically, and the challenge a lot of times in like Pierce County comes because some of the red tape's literally because of our finance system, and there's reasons where we have to provide documentation and it can cause some challenges. Realistically, with the property tax increases over the last couple of years, county veterans programs have gotten a lot more money than they had before. There's counties out there that are doing creative things to figure out how to spend that excess money. Like Kitsap County increased their maximum allocation over the last couple of years because they're trying to do new and unique things. So I think we're in a good position now when it comes to trying and having the ability. For me, I think it's just having the elected officials that are open to do those new things, which is my biggest struggle.
For Spokane, I'll say this. I mean, we have great support with our county commissioners, right? They back us in any way, shape, or form. For us, it's trying to be more innovative, right? So a lot deals with the budget constraints that we're all feeling right now, right? So in that respect, I go back and go, okay, well, how can we be innovative and still serve veterans, right? And how can we utilize those dollars, the property tax dollars, for the veterans and their family, right? And a lot comes down with collaborating with other partners, right? So there's that collaboration piece. It is a must right now. You know, in our office, we have WorkSource that comes in. You know, we embed HUD-VASH, right? So we're creating this, like I said before, that one-stop shop. But when I'm talking kind of like staffing and doing the work and how the budget operates, one thing to keep in mind is the way Spokane is able to do the things that we've done is because we really rely upon our VA work study program. That is huge. So if you don't have that within your own offices, I highly recommend becoming a site supervisor for that program. In addition to, Spokane County is recognized as a DoD SkillBridge industry partner. Right here in Spokane, we have Fairchild, so close. We go out there, we facilitate the TAPS classes or Transition Assistant Program classes, right, briefings. But that network too, to allow those transitioning service members to come work anywhere in the county, not just Veteran Services, but anywhere in the county. And it's because we have those that are facilitating those administrative roles that we're able to concentrate our efforts on more educating veterans and their families, more quality claims, right? And so that's just elevating us. So I recommend, if you haven't took a look at those programs, please do so.
We looked at those programs and we don't have the individuals that can participate in those programs really in our counties, like personally. So we have to get creative in other ways too. And again, it's like I kind of said earlier, it is that partnership building. So for instance, one of the biggest things that we would see for the relief fund in our area is every year, right before winter, firewood. We need firewood, so people need firewood. So we started identifying, all right, well, how do we like get ahead of this? Because we're seeing the same people, it's a Band-Aid, and that's, while we do want to be givers and we do want to help, we're also stewards of this fund. We have to make sure that it's appropriately being used and managed. So we started reaching out, building partnerships, and created a partnership with WDFW, where if they've seized wood that's been poached or something like that, that you can get your name on a list to recover that, stuff like that. And it's continuing to think outside the box and build those things. My boss is in the room, so there's other red tape ways that we cut, but there's other programs, there's VFWs, there's Legions and stuff like that, where if we see something that will be a tough sell. So for us, our threshold is 750. 750 can get approved without commissioner kind of looking at it or whatever. But they need $1,000, and it's, I don't know, I'm gonna make something up. We'll just say like a transmission or something like that. And we're like, I'm not sure the commissioners will really bite off on that. But we know that the Legion has this program or that's going on. Try to shift and say, like, how can we share this load, this burden? Or, more importantly, is there something else that we can pay that makes more sense when I'm speaking to my bosses about this and I'm trying to sell it? Can we pay you rent that's $1,500? You know what I mean? How do we do that? Now, it's a slippery slope, so we have a Veterans Advisory Board. We kind of monitor that, but you do have to kind of think outside the box and do that. But we do want to transition to not being Band-Aids. One thing we identified real quick was on the relief form, there was nothing that ever said, have you spoken with the VSO? Have you talked to anybody? Are you receiving benefits? And so we're not forcing anybody to do it, but there's a box check now. Would you like your VSO to contact you, or a VSO to contact you? Would you like to speak to a VSO? It's worked. We get people that we can change a little bit, even if it's $175 a month for nothing, 10%. It's still better than what they came in with. And now, maybe we get some healthcare flown in here, and just slowly start pulling that thread. In our area, trust is like the hardest thing to build, and sometimes it takes just that little thread to pull to keep building that trust and get people to come back. I'm sure these guys have seen it. You start talking about claims, you do a claim for them, but you can tell that they just don't want to talk about that PTSD, and then okay, so let's work on what we can work with, But I encourage you to think about this process.
I'm sorry, go ahead.
But as soon as you get that claim to go through and then it gets adjudicated, and hey, well, look at that, now I got 10% for tinnitus, maybe I can talk to this person. Maybe I can go about getting what else is in my record, Building that trust helps.
One I would say to that, thank you, by the way.
Yes.
But I would say that it's really about that shared report, right? To your point, it's not only leveraging the county resources, but leveraging the relationships you, oh, thanks, Paul. I'm the worst. But it's, yes, sir. So it's about leveraging those relationships. I mean, I work inadvertently, indirectly, and indirectly with all of your counties, even Clark back there. So building those beneficial relationships, leveraging your community resources, and then piggybacking off each other. Whether it's VA, nonprofit, federal, state, private sector, right? Now I'm biased to Pierce County because I live there. But at the same time, it works, right? We've seen those results. We've seen what that targeted, coordinated whole health and that functional overlap looks like. I mean, we work with Chris all the time, or Dave does all the time. I mean, it's functional, and then it's being mindful of what we do have so we can piggyback on those things. So, thank you.
So here's another for small county VSOs or starting to get VSOs. What I'm doing and have done is I started hitting our big public, like our Helping Hands, Community Action, Anacortes Family Center, Senior Centers. Is I started training them how to look up VA Form 2122 and in our intent to files. And I'm saying, hey, you can't tell them what to put in there, but you can help them if they need to fill it out. And if they have questions, they can ask me. So what we're doing now is I'm having them sit down at that office, make an appointment with me, but doing the paperwork and sending me the DD-214 with those documents, or doing the phone call over the phone to get that started, because I know I'm not gonna see them for 3 months because of how backed up we are. But that is the fastest way we can get in my county, that's the fastest way to get the intent to file going. That's the fastest way I can get a POA in. It's the fastest way to let them know that there's a VSO waiting to see them, so they're not stressing out going, I don't know what's next. So that's something we had to get done there.
Right, and maybe I'm gonna regret saying this, but don't be afraid to reach out to other counties. Like, I don't care, small, big, large, whatever. Don't be afraid to reach out to the other county offices and ask questions. I do it all the time. I'm sure Chris has probably got like 20 emails from me asking, like, hey, how do you guys do this? Why do you do it this way? What's the deal with this? What would you guys do in this situation? Because some of these programs, yeah, there's differences between them, but a lot of times we're interpreting literally the same language. And sometimes it's worth just saying, what are your guys' thoughts before I take it to my own advisory board, or before we internally talk about it, reach out to those other counties, you know?
Yeah, so that's a great segue into my question. So thank you for that. I'm with the Thurston Veterans Advisory Board, and so I'm one of those people who meets once a month, which is a lot better than when I first started, when it was once a quarter, right? Not too long ago. And we're getting ready to have a strategic planning day, full day, towards the end of September. So I'm here to, get ideas. And so what I'm hearing a lot of is that there's, that all the idea sharing is pretty much ad hoc. There's this session here once a year, presumably. This is my first time here. But other than that, it's just kind of, hey, I'm asking my neighbor county, how do you do it? What are your ideas? Would there be a benefit from your perspectives of having a more coordinated body or organization or way to share ideas among the various counties in the state? Thank you.
I may not be answering your question, right? But this is where I'll always say it depends upon the county, right? So the Veteran Advisory Board is in place by RCW, right? And here's the guidelines. And yes, we've talked a lot about the Veteran Relief Fund, right? But I want to emphasize too that you have to understand the Veteran Relief Fund is not just there for helping veterans in emergency or crisis situations, okay? I'll use my office as a prime example. That Veteran Relief Fund actually pays my staff, pays our building, pays the other daily operation side of the house, right? Which includes the claims assistance piece with it, right? So I know we've talked a lot about the Veteran Relief Fund on that, but to go back to your questioning, I really, really think it's dependent upon what is the need for the specific county. What is the challenges that county faces, right? And what are the veterans and their family members asking for within that county? And as a Veteran Advisory Board member, that's your opportunity to provide that feedback to whoever's facilitating. Right, as you heard, we have different ways that things are being facilitated. But I'll just put that, and I'll leave that to the other gentleman up here to.
I was gonna say, there's a state group here that could probably put together like a rural county meeting and a larger county meeting, or maybe a big county meeting. Mr. Tucker. Like, we could swap stories, kind of.
I think it's always beneficial, right? Knowledge is power, and just because he's doing something that doesn't necessarily fit exactly what I need, there's gonna be nuggets in there. There's gonna be something that I can pull from that. Probably vice versa. And there's also where you're at now and where you wanna be, those are also two different conversations, Where we're at is we are in Band-Aid mode, and that's my own term, but we are in people come in, they need assistance, we do what we can, but we're trying to dig out of the mud to say all right, that is definitely a part of this that we need to focus on and be able to do, but the return on the community is funding another VSO. The return that we will see from that into providing benefits, providing health care, providing maybe a more stable income versus getting you firewood, that return to me is we need to be transitioning towards a program like this. So I need to know, and I need to be watching what he's doing. I need to read how they do it and pull from that and say all right, yeah, that makes sense for them because there's a bigger population, yada, yada, yada. But the framework for that is the direction I need to go. And then I got to convince all the people that live in my area that that's where we need to go, because it is an advisory board. Just because I think it's a great idea doesn't mean everybody else does, So I think there is I personally feel that would be amazing if somebody could set that up.
Good afternoon. My name is Will. I'm also Air Force Gulf War veteran. So, yay, am I? I'm also part of a community-based organization that works specifically within Native veteran communities and Two-Spirit LGBT veteran of color. Based in South King County, which, King County, lots of money. South King County, little money, lots of veterans. My question to the panel and folks in the room as well, because I've had the honor to work with almost every single county that's currently represented in many different ways, from either at the county level or from the actual county resident level. But what partnerships, formal or informal, do your programs have with the local tribal communities, both on and off tribal lands, if anything?
So I work with Upper Skagit. They send all their veterans and family members down, Swinomish and Samish. Like I said, Samish they're working on getting me in a spot where I can periodically go in there monthly so that way people don't have to necessarily drive to Burlington or somewhere else they don't want. But, as recently we had an elder who was a Vietnam era veteran living on the streets for some reason, and we were able to, I found out through the WDVA, that's her fiduciary, so it's, those are I think that kind of opened the door for trust, because there's got to be a lot of trust. My kids are Samish tribal members, so I lived on the res with everybody else for a while, but there's a huge amount of trust issues there, but if you can show them that you can help out and do the job and all that stuff, and I think that's a huge barrier that we, as service officers in our counties, we need to really work on that. And realize that they're not going to think the same way that other veterans are coming into our offices. They're not going to do that, and they're going to want this and they're going to want that, and you're just going to have to say okay. But opening those doors up to those three tribes has benefited those members in that tribe from working with my office and myself, and those leaders of those tribes are happy to extend that invitation. So.
As I say, we have a really good relationship actually with a lot of the tribes. I meet multiple times a year with Puyallup tribe. Cowlitz actually has a building up in Pierce County. They have a huge population of Cowlitz tribe members up in the Seattle, Tacoma area. So they bought it's actually an old Girl Scouts building that they purchased and converted it into a resource center up there. So we work directly with them and a lot of the tribes. And I think you're right, like it's developing those relationships, you know, across all of the different tribes that might cover in your regional area. Is just because they don't, you know, the tribe may not be in that area, but they'll have members in your area, and it happens a lot.
I think for me, you know, any organization that's trying to serve, you know, our tribal veterans is just to be open, right? Because there is that trust that backs it, right? So be open to accept every veteran and family member, no matter what, right? So just having that message that your office is such that, I think that goes a long way.
We operate in the same. We've tried to build some relations, and unfortunately we had a little bit of a political mess that was outside of our ability to do anything with. So we've been doing a lot of trust building, which is, you know, understandable. And again, just being open to, you know, make that extra mile sometimes, especially for our areas. It's remote area, so you know sometimes it takes like coming in a little bit early for us, or opening the doors specifically for a time slot for someone to come in, and making sure that there's a window because they're driving 3 hours to get there from the drive. Like it's something that, and we like to do that. Like that's you know, one of the big things that, not necessarily tribal, but like in our region, we lovingly call them the bush vets. How do we get them to come into us? How do we get to them? How do we get to the people that don't want to talk to someone from the government, but probably would be the most, they would benefit the most from the services we could provide, you know? And so it's an ongoing conversation that I think that is ever evolving in 1,000 different ways, and will ever evolve for down to the individual level, you know? But you have to have that mindset to be adaptable to that, and the want to do that. And then more importantly, the time.
Hi, I'm Becky Vera. I'm the Veteran Service Officer for Whitman County, and I just had a couple of things about the collaborative effort. Being so rural, in our tiny little county, not a lot of resources, and I found it really beneficial to partner with people that are already doing things within the county, and then piggyback onto them. So Council on Aging, most of our counties have a Council on Aging with a coast. Our coast, you can be a veteran and you can volunteer to be a driver just for veterans. You can decide what appointments you'll take and what appointments that you won't take, and they will pay you a stipend of the mileage to go do that. So there are ways to work within the system that's already up and running. When DSHS has their mobile clinic, I'm able to go out and go with them and talk about VHA. And hey, this is how you sign up for VHA. So it's already things that are already happening that I try and partner with, that has been really helpful with the local agencies that are already, you know, knocking it out of the park with whatever it is they're doing with like transportation. Speaking of knocking it out of the park, Chris has a meeting on Tuesdays for Dorcheus, Spokane.
I go visit him too.
Has a meeting on Tuesdays for veteran service officers to case conference, where we collaborate on, hey, this is happening with hearing loss and tinnitus. Are you guys seeing this too? Or this is how we're getting these claims through. This has been successful. This hasn't been. It's really a wonderful time, and I think they're invited.
Everybody's invited.
Yeah, so that's a great resource too.
So, oh, sure. Okay, this is a very specific question. So when I first joined the Thurston Veterans Advisory Board, I was told, yeah, we don't do food vouchers because they're too hard to manage and too difficult to get from the grocery stores. Yet I heard Mr. Sheetz mention food vouchers, so I'd like to know your experiences with food vouchers, because I think that's something that we should be taking a look at in our county.
It's all about building relationships with groceries. I'll start with that. For us, we have grocery outlets, we have some smaller groceries that we partner with, and we continue to partner with smaller groceries. We can't do it with Safeways, Fred Meyer, Kroger, anything like that. They won't do it anymore at the corporate level. So it's all about, if you're gonna do food vouchers, and I'll be honest, it's one of the highest things that we do voucher-wise every month. Food's expensive, veterans need to eat. But, doesn't mean you have to do it through food vouchers. But if you're going to do food vouchers, it's about building relationships with those grocery stores and building trust with them that the county is going to cover the cost if that's part of it, and that they can trust you through that process. It's all about relationship building, and it takes a lot of work to do that.
I will say an alternative method, so we have the same thing, but we haven't had a whole lot of issues with like the bigger grocery stores, Safeway and all that. We're able to facilitate the voucher system with those grocery stores. But at the same time, if you need an alternative, if those grocery stores aren't willing to accept a county voucher, we get Safeway cards, $25 Safeway cards, right? So if veterans come in, they need $25, $50, even $75 just for food. That's an easy alternative. Here's a couple Safeway cards, and carry on there.
So you can go into you can actually order Safeway cards and are just for food specifically, and you can order those so that you don't have to worry about it being used for tobacco or alcohol or whatever. In Skagit County, we've had the issue that we have with vouchers is the Fred Meyers, the Kroger's, the grocery outlets not turning in the vouchers when they're done with them on time, because you got to put it on the budget of that calendar year, not on the next year, right? So that's one thing I'd watch out for, is if you do set that up, the voucher system, make sure that those businesses you're going to be using know that they need to turn those vouchers when they're used, they need to turn them back in with the proper paperwork before a certain date. Otherwise it's a huge mess in the money world. So
We got one question back here, and we'll look front.
Hi, how's it going? Michael Littles with Humana. I'm everybody's neighbor, so hi. How's it
Howdy,
going?
neighbor.
My question is in regards to bandwidth. So I know you guys are spread really, really thin. And so when it comes to community partners, do you guys have a preference on, if there's somebody who can handle something for you, do you guys prefer to handle that internally first and then pass it off? Or if somebody else can handle that, do you guys pass it off right away?
We do the warm handoff. If I know somebody that is somewhere, I would call Chris and I'd say like, hey, here's the situation. Here's what they're looking for. I know it's your wheelhouse. It's not our wheelhouse. We're gonna send them your way. And anytime that we do a handoff, we make sure that we've communicated to the individual like, hey, this is the person that you want to go see. This is the person you want to talk to. But we've also communicated with that individual that we're sending them to, like, hey, this is the person that's coming your way. Here's the situation. Do what you can. And that's helped build fantastic partnerships, because it is a two-way street. Because you're right. I said it earlier too. We can't all be experts at everything, and I don't have the brain for that. You know what I mean? So like, why would I try to pretend that I can do what Steve does when Steve does it really well? So if Steve's got the time, we'll send him to Steve. You know what I mean? Like that just makes sense to me. So yeah, I'm not a big let's hog all the clout. That doesn't make sense to me. It's not about us.
So in Skagit County, what I've learned is that a claim is 144 days on average, right? So you don't know if you're gonna get compensation or not for that many days possibly, maybe shorter. So we need gap fillers, and the gap fillers are the helping hands, the community actions. So if direct services out of Skagit Vets Connect, and they qualify for that, boom, I got Carmina sitting right there. I said, hey, I need this vet needs to be put in a hotel, get in coordinated entry. They need to do all this stuff, right? And then if Helping Hands is available, they have direct service money as well. And what if for some reason they've already followed the policy and procedures, spent $2,000 in hotel, I'm gonna go to Helping Hands and say, hey, can you guys also bridge the gap there? Even if there is no housing on the other end, right? But we want to put vets on their feet and get them feeling better about themselves and possibly in these other things. So gap filling is I don't know if you guys use that terminology, but I think that's the most important thing, especially when you get a brand new person coming in, because they might be straight off the streets out of their truck, or they might be through some DV or something happened where we need to figure out how to get them the food, transportation, the housing, and all that stuff, and kind of stabilize the situation, so that way we can sit down with them and do the claims assistance and all that. So.
Thanks. Earlier you had spoke on having these relationships with the grocery stores and whatnot, gift cards, vouchers. I'm just curious if you've explored creating those kinds of relationships with farmers markets or farmers directly?
So I'll say for us, we utilize a data management system which creates our vouchers as well. In order to do so, of course, we need, if it's rental assistance, we're going to need a W-9, right? We're going to need a W-9 from the vendor. So for us, it really doesn't matter what vendor we utilize, as long as we have the documentation that we can put them into the system for that, and to be able to create a voucher to get paid by the county per check. So I don't think, probably didn't answer your question. We haven't directly done that, but there's opportunity for whatever service providers out there.
So for example, we run into that with wood, right? John has extra wood, wants to sell wood, gonna sell it to the vet. Yeah, I do a W-9. Has that stopped some things? Yeah, because people get a little like, oh, well, I'm not doing that. But it would, in theory, it would work for a farmer's market or something like that. We haven't done that, but maybe that's something that we should be looking at, especially, yeah.
In Skagit County, that's where I'm at, right? So Helping Hands and other food banks, I call them, they'll deliver the food most of the time, especially Helping Hands. And we get them fresh fruits and vegetables, breads. If they need quick food where they don't have a voucher system or they don't have a store card right now, I just make the call. I mean, they're literally here. I make the call and they make it happen every single time for me. And it's also good to have veteran-owned nonprofits. So just so you know, look for those guys.
Yeah, I think the W-9 point's a really strong one.
All right, so as we continue, great conversation. I'd like a little bit of audience participation in this. Are there any other tribal or county representatives that are in the room that haven't had a chance to speak yet? You know, one of the things that we're talking about is partnership, and I'd really like to know if there's other folks. Yeah, ma'am, please, here.
I've been listening here, and I'm kind of excited about what I heard, because as Coffle Tribe, we're probably one of the only or very few tribes in the state of Washington that does everything all of you do as a tribe. Our money comes from, that support us from our tribe. But that doesn't mean we haven't reached out to Okanagan County, Ferry County, Stevens County, Spokane County, Arizona State, Texas State. Wherever our tribal members are, we help them. So we work with all resources in that area. We sit there, if we got somebody in Arizona, we go to search that state for everybody who does anything for veterans and say, how can you help our veteran? And what do they need to do? and how can we get them to you or you to them? But anyway, because I'm really, listening to this, and it's been a lot of years that we've been doing this. So we've been doing this since probably the 1980s. We started out, what we did was like get their DD-214s, get them housing, buying their houses. That's how we started out. But now we do everything that you guys do. We have, I think, a fleet of about 5 or 6 vehicles now that we transport all over the place. Seattle, Tacoma, because that's where our veterans have to go for some of their exams. And also we work with the VA. So we tap their resources as much as everybody else's. And we meet with them practically on a monthly basis. Say, okay, what do you got? Or what's coming up? How can we work with our veterans to make that better for them? We don't want to wait until they fall in a hole before we help them. So if this is coming out like when the PAC Act was coming out, we heard about it. So what does that mean to us? And how do we get these people connected? So the Culver Tribe has stayed abreast of all of this. And what we're trying to do now is get accredited officers. And it's not that we don't know how to fill out the forms. We have done these forms thousands of times. And we have sent them in, got our DD-214s, got them connected with the VA for health, brought them out here, get their primary care, get them a doctor in the community, because we tell them, you don't have to go to VA to get your medical. You can get it right in OMAC, or right in Grand Coulee, or right in Brewster. We got doctors, there's VA doctors out there. So, then they start saying, really? We said, yes, just like a health insurance, So, we've had to educate them. As we got educated from the VA, we tell them. So we have done all this kind of work as a tribe. And our staff is growing. So we have 2 people now just dedicated to transporting. And then we got ourselves what we call a wheelchair van. Geez, it's man, you look at that thing, I said, I'd like to ride around with that. But we managed to get that because the tribe said, this is what we need for our veterans. But you know what? We don't only haul tribal veterans. We was helping this veteran out of Indians Valley. And he was a Vietnam veteran, and he was having problems. And we took him to Seattle, to wherever he had to go for his care. And eventually, we lost him. That was so hard to watch that happen, but we as a tribe reached out because there was nobody else to help him. And we've done that for other people in our area. So it's not just tribal members we help. We've helped all kinds of people. Veterans, and we used to do a stand down, but now we don't got a building big enough to hold it anymore. And we tried to have like a veterans, like a meeting there, where people come and train us. We realized that when that happened, all of the tribes sent Indian people there, and we didn't have enough room. So, we have kind of held it off because we got to have a place big enough to house all these people. And so, as a tribe, we have come a long ways watching everybody grow. And believe me, we reach out to every resource there is in our county to help our veterans and their families and say, okay, what can you do for them? How can you help them? Do they need to fill out an application? Give us the application and we'll get it to you. So, we're on the phone, we're on the road, always reaching out, always trying to make those connections. And we try to do with everybody around us because we know that we're not alone in this business. And there's other resources that come and go, so we try to keep. Just recently, we reached out to Spokane here, to an organization in Spokane to help a veteran over in, I think it was OMAC. I thought, holy smokes, how did we do this? I said, this is a Spokane resource, And I said, wow. Well, hang on to that number, hang on to that email address, because we're going to use it again. And we try to reach out to like all of Spokane County for some of our veterans that are out here, to share. Say, we'll help them, you help them, and keep them going. Thank you.
And as I walk to my next question, shameless plug, please don't forget to fill out your survey for feedback. The comments you give us will help shape the next year's program, so we greatly appreciate it.
Thanks, Paul. Hey, so this is something I've been thinking about the last couple of years, and I'm trying to find out if anyone has implemented this within their organizations. So as far as SSDI, I don't know if you have, how many clients you have on a weekly basis that come in that are trying to do that. Well, at one point we wanted to implement a one-stop shop, but the challenge is Social Security Administration. Has anyone been able to implement where someone comes in physically and able to help clients out with that? And how did you go about doing that?
So for Spokane County, we use and utilize our staff assistants that went through the entire training. Thankful for that, just to have that ability, if need be, to facilitate filling out for SSDI. So that is full implementation with Spokane County. So
yeah, I was gonna say most of your area agency on aging or your AAAs are gonna have SOAR certified individuals that can do it. So it's really reaching out to them and seeing how you can partner better with them, because they're already gonna have the resources. It's just how do you connect with them.
So would that be using the SSI facilitator from your community service office, perhaps?
I'm gonna tell you, once again, Skagit County Helping Hands, right? They have a team of women that are, one's a DSHS board member in our area, and I call them up and I say, hey, I got folks that need help with paperwork on Social Security. They go, okay, let's call them. They meet them, and 6 months later, they're all of a sudden they're getting a check. You know what I mean? Or things have changed. So building those relationships, honestly, I can't do it all by myself, so that's why I have to find the people that are reliable, most educated on these programs, and then once I know that I can trust them to do these things, I just keep using them, because geez, if I was sitting there helping them fill out paperwork, oh man, it would not come out right.
Thank you for the conversation. I know we have a lot of other county and tribal partners in the room. So Whitman County, thank you. Thurston County, thank you. Lottie, Colville Tribes, thank you. Are there other counties or other tribal partners that have not at least had a chance to introduce yourselves yet? Because we do want you guys to meet each other. That's part of the discussion. And maybe just introduce yourself and what county you're from, if you would.
Hi, I'm Patrick Goldburn. I'm representing Lewis County VSO. And one of the quick questions that I wanted to ask you guys, do you guys incorporate times and dates real quick for your people, veterans who are 2 hours out, do you have a walking day in regards to 7, days of the week?
So for Spokane County, we have a unique intake system. So people could walk into our facility. We're going to help them fill out an intake if need be, or different modalities of that communication too. So we can send an email with a QR code where the veteran and or family member can go ahead and scan. It fills out our entire intake, start to finish, kind of what the need that they're looking for. It also auto-populates the 2122 and the ITF. And then it gets sent back to essentially an email address to us if that's the way we do it. And in doing so, we get the information, we establish POA, which allows our veteran service officers to be able to look into the file before a conversation is had with that veteran and or family member. And that typically takes a week. So from our office, we'll say it's a week turnaround time to have a conversation with the veteran service officer, right? So that our intake process, that's where I said for us, it's unique in that respect. Yes, we allow walk-ins. And I don't know, what was your other portion of that question?
Any day of the week or just one specific?
So we are open Monday through Friday, 8 a.m. to 4:30 p.m. We do close for lunch between 12 and 1.
But you do walk-ins a specific day or just
It
any day?
really doesn't matter. No specific time, date.
And by the way, Patrick, thank you for coming. Patrick is our newest WDVA accredited County Veteran Service Officer in the state, by the way. He just started accredited last week and is already here at the conference. So Patrick, it's good to meet you. We talked by email, but we didn't have a chance to connect. And Tucker, you got to get on the train. Patrick is ready for you. No, I know you guys have been talking already, so thank you, Patrick. Thank you, Tucker. Tucker, I mentioned earlier, helps provide training for some of our County Veteran Service Officer partners. And I knew you were here somewhere, Patrick, so I'm glad you introduced yourself. Other counties or other partners that we haven't had a chance to introduce yet?
Ray Hernandez, Yakima County Veterans Program. One thing I did want to say to piggyback off of Chris here is the relationship with the tribe. If you haven't, the tribal reservations, they're essentially their own entity, but they do fall under the county, whether, it is what it is. Go make those relationships. We've gotten to the point where we're visiting the tribal office at least once a week, and that's a very minimum. Especially the poverty level within the reservation. I try not to make them travel. The least that they have to do to gain services is, I tell everybody I get paid for mileage. They don't, and so just try to build those relationships. If you haven't contacted your tribal liaison or program manager, we're very fortunate. Yakima Nation has their own veterans program, to go out and do so, because with any organization, within Yakima, we're small, we're underfunded, so we have to partner with those agencies, those nonprofits. Yakima Neighborhood Health, Yakima Housing Authority, United Way, OIC. I can go on and on, but we're connecting almost on a weekly basis. And the biggest thing I have written in my office, is continue to serve one more veteran forever. And that means just if you're done with one, you go to the next. What we do is, we've all said it, we all have the Veterans Relief Fund, but there should be no reason, and this is what I implement in my office, that it's not, we don't do that here. There's never should be that. And I'm just trying to explain, exactly what we do in our office, but in overall, as a county public service provider, it's the warm welcome or the warm handoff is amazing, because you would be surprised of how many veterans come in and just say, well, so-and-so just told me to come here, or so-and-so, and it's like, for instance, it's GI Bill, the county has nothing to do with the Veterans Benefits Office, but hey, so-and-so told me to come here, and if they would have done 2 minutes of research, they could have gave them the proper number, the proper person, or whatever. It's just, do that little extra. And I'm not telling you anybody what to do. It's just, that's what we've implemented in our facility. And we're, beyond the vouchers is, the vouchers are a huge part of our program. Just try to do a little extra, and we can get so much farther, especially with these younger veterans that are returning and kind of lost in the world. I can explain just personal history. I got out of the Marine Corps, became a police officer. I was kind of chasing that combat mindset and didn't realize how many benefits I had waiting on me. And it took me 7 years to do anything because I didn't think I deserved anything. And just to now to implement that for me to serve the other veterans is amazing, and it's huge. Like I said, just to serve one more veteran. So thank you guys for listening to me real quick.
Is Lewis County a small county?
No.
No? I don't know.
Liz.
Gonna lean on a few people, but come back with those hands. I haven't forgotten.
I'm Chuck Whitman from Stoughton County. Stoughton County is not part of Idaho. It's down the southeast corner part of the state, where the Clearwater and the state come together. Population only about 22,000, very small county. our veteran relief fund's only about $22,000 a year, and we have about 10% of our population are veterans, not counting families, widows, and stuff. We've had a very active VAB board there for many years. And that in conjunction with some of us, a group of us VFW members took over the VFW, and we opened a veteran outreach center there. We had a lot of community support, put about $400,000 of cash and donations into the building. Thanks to WDVA, who either recognized our efforts and or our insanity. We have a full-time veteran service officer who works there 5 days a week, and recently we added a PTSD trauma counselor from Quality Behavioral Health there 1 day a week. It's big, it's making a big difference in the lives. And I can always say partnerships are very important, especially for a small county. I can't list the number of partners. I mean, you got WorkSource, WDVA, I've got, gosh, I don't know, SSVF, Community Action Partnership, Quality Behavioral Health, a lot of nonprofits. I used to run a nonprofit there, so I'm kind of connected. And so it's very successful. I always tell people, welcome to my zoo and I'm the ringleader. But we do a lot of events there, and it's partnerships is what makes it work. And the other thing is by having we have 3 groups there, the VFW, but the American Legion and the Fleet Reserve Association. I brought them back into that building as their post home. So they help run it too. So it's helping their membership, and it's great to go in there on the day and see people sitting around the table BSing. And I have a shovel by the front door. It says, please clean up after yourself when you leave. But the first step in recovery for a lot of veterans who have issues is reaching out to other veterans. When we first started the center, one of the things we did is we got together, and the Rotary, I spoke to them for money to help remodel, and then he says, well, we don't want to do that. Well, we want to do something for veterans. So they had an idea, and we got together and we came up with a Suicide Awareness Challenge coin, which we distributed over 6,000 already. We do the Learn class here routinely, and this challenge coin, the nice thing is we give it to a veteran. We say, this is not a collectible. This is you meet a veteran or see a veteran that's kind of down, isolated, or whatever, give it to him. He might decide to call, because on the back side of the coin's a 988, the veteran hotline and the veteran text number. And I've had families come back to me and said that it has worked. And so the other thing this does is probably even more important. When you give it to a veteran, it opens up communication veteran to veteran. And they hear there's a place they can go. So anyway, it's a unique situation down there. I don't think you're going to find it anywhere else. And I just want to publicly thank WDVA for their support, because they are really affecting hundreds of veterans.
Thank you, Chuck. I saw you sitting there. I wasn't going to let you get out of the room before introducing yourself. So we talked about a lot of stuff today, and this was really meant to be a conversation. As you guys saw, there's the 4 counties at the table. There's a lot more in the room. We have rural counties, we have urban counties, we have Indian tribes. Many of you work with nonprofits or other organizations that are inherently part of the support network. So we covered a lot of stuff today. It was a little organic, but that was the way it was intended to be. I wanted you guys to get a chance to maybe get a few names and faces, because we have another day left. I also want to take the opportunity, before I turn the mic back to Paul to wrap up, I want to introduce WDVA's new Assistant Director for Veteran Services, Counseling and Wellness, Abu Nelville. Now, Abu, come on up if you would for a minute. Abu's my boss, by the way, so tell him all the good things that we do. Introduce himself. This is his first Serving Those Who Serve conference, so thank you, sir.
Hey, thanks, Steve. This is my first conference. It's been great. I'm learning. A fellow veteran myself, served in the Army for 26 and a half years, retired in 2022. So I'm passionate about it, and you'll have my name and number. It's kind of unique. So if you look it up, you'll find it. And I'm there on the website with Solomon and David. Reach out to me if you have an issue, and I'm going to try my best to connect. That being said, if I can get those coins, are you ready for it? I think there was a gentleman that had a question sitting next to me, or he wanted to say something. I'm not going to cut him off.
No,
So,
I'm
still good.
I'm good.
Okay. So it's been a pleasure. Thank you, Steve. Thank you all for all you do. Like you said, one more. And that's what I'm going to keep doing, and that's what we all done here. So I wanted to thank you all for what you do at the county level, and I'm gonna do my best to meet all of you one-on-one and learn about what you do from you. Okay, so, sir, thank you.
Thank you. Thanks, sir.
I know I'm holding the wrong hand.
No, no worries.
Thanks, sir. Gotta hold the mic. All right, well, thank you all. I'll still be around here. Somebody told me you got one. So, okay, we'll figure it out. You only give me 3 and my numbers are off. So, thank you for all you do. I'll still be here tomorrow. Stop me in the hallway and reach out.
No.
Do we only hire the Army and WDVA? Is that what's going on?
There's just more, that's all.
Hey, we can't help it.
All right, so before we leave, can we please give our panel members another round of applause? So as we close up, I remind you to please again fill out the survey. You can use the QR code to get to it. And there is a wonderful social tonight, right here in the lobby at 5 o'clock. And I was told that there may be a slow dance between Sean and Robert over here. During, we'll see, you know, so I'll pay for that.
I'm not ashamed, my friend.
Not ashamed. But yeah, thank you very much. We hope to see you at the social. The conversation does not stop when this ends. It continues at the networking event and throughout the rest of the conference. So thank you.